I just want to, first of all, thank you all to everyone who's joined our session today quite late on a Friday evening or afternoon, depending on where you're joining from. I would like to start by introducing Find and also myself. I'm Karishma and I work at Find. And I will introduce Find and then also our diverse group of speakers that we have today. So Find is the Foundation for Innovative New Diagnostics. We're a global non-profit organization driving innovation in the development and delivery of diagnostics to combat major diseases affecting the world's poorest populations. So we work on numerous diseases, including TB and now COVID-19. I think all of us attending this conference are well aware that COVID-19 is having a devastating impact on diseases like TB. And the Stop TB partnership early on in the pandemic released a report which showed that we might have anywhere between, or at the very least, 5 to 8 years of a setback in our fight against TB due to COVID-19. So you may have also seen the recently released WHO Global TB report that shows that 1.4 million people died from TB in 2019. And of the 10 million people who developed TB that year, 3 million were not diagnosed. So this again highlights that diagnostics continue to remain under-resourced and overlooked. Equitable and timely access to the much needed tools, including quality tests, is really something to which everyone should have the right so that they can get the care that they need, whatever be the diagnosis. We're really here today to talk about how to advocate for these tools and how to continue our TB advocacy, which all of you are very good at doing, in the middle of a pandemic. So without further ado, I would like to introduce you to our speakers today, who will talk about adapting their TB advocacy in COVID-19 times. So we have with us Dr. Robin Christian Waite. She is a Policy and Advocacy Manager at Results Canada. She is effective at building coalitions to progress common goals, and she's a fierce advocate herself in the fight for a more equitable world. We have Dr. Saurabh Rani. He's a healthcare innovation specialist, and he's an XDR TB survivor. He believes in action-led advocacy. Despite suffering permanent lung damage due to his long treatment, he continues to run marathons and climbs high altitude mountains to inspire patients and raise awareness around TB. Lwazi Laba is the founder and CEO of Zulo International, and he's also the co-founder of the Pan-Africa C19 Survivors platform. He is an activist and Global Fund Replenishment Champion and GFAN Africa advocate. Lwazi is based in South Africa. He is a COVID-19 survivor and he's living with long COVID-19. So it's really wonderful that Lwazi, despite what you're going through right now, you can be with us here today. We also have Nombasa Dumile from South Africa. She works at MSF as a drug-resistant TB counselor. She's also volunteered at the Treatment Action Campaign and is a treatment literacy practitioner. She's been in the field since 2000 and is passionate about HIV and TB. She is a mother and an activist, and she loves working with kids. Nombasa has had her own tryst with HIV, TB, and now COVID-19. So we really look forward to Nombasa and the rest of you sharing your experiences. So my first question was to go to Robin, but I believe that Lwazi is not feeling too well. So Lwazi, do you want to go first or should Robin go first?
We can allow Robin to go first, yeah.
Okay, great. So we stick to the plan.
Yes, please.
And my first question then goes to Robin. So Robin, you have recently developed a report on the results of a global civil society and TB affected community-led survey. So could you please share the key highlights from this survey and with an emphasis on how TB services have been impacted by the pandemic and especially TB testing? We'd love to hear from you.
Yeah, of course. So hello, everyone. I'm very, very pleased to be with you all today. I'm Robin Waite, the Policy and Advocacy Manager with Results Canada, and I'm very proudly repping my swag today, coming to you live from Ottawa, which is the nation's capital. So FIND did invite me here today to share the experience about how the TB community responded quickly and took action in response to the COVID-19 crisis. As advocates committed to ending TB, we knew that we could not sit idly by while people with TB and TB programs around the world were being devastated. We learned and understood early in the pandemic that lockdowns would impede our ability to find people with TB and get them on much needed treatment. That TB resources like healthcare personnel, lab space, and critical infrastructure like gene expert systems were being diverted to respond to the immediate needs of the new crisis on hand. So what did we do, and how could we take action and respond meaningfully? We, and by we, I mean 10 global networks fighting to end TB, decided to pool our brain, resources, and network power to launch the global survey initiative that Karishma was just speaking about, really seeking to understand how key stakeholders involved in the TB response were experiencing the pandemic. And just to note that this initiative was specifically designed for advocacy purposes. As the TB COVID-19 Civil Society Working Group, we embarked on what we called an advocacy-oriented research project. So we designed an online survey with questions tailored specifically to people with TB, TB researchers, frontline TB healthcare workers, TB program and policy officers, and of course, TB advocates, which included TB survivors and civil society organizations. As I'm sure you would expect, and you've heard a ton about throughout the Union Conference already, our findings revealed critical gaps and needs in TB services. And I'm not going to share all of the findings with you here now because that would take quite a while, but I will share my screen in a moment and point out some of the key diagnostic related findings, as well as how you can use this piece of work in your own advocacy. But before I do that, I did want to give a bit more about the context into why this initiative was important and how it is a really good example of coordinated advocacy to be celebrated. So of course, the findings and the outputs of the project are important, but so too is the process and the coalition building that took place. It was because we as CSOs united that the calls to actions that came out of our findings could not go unheard. If Results Canada embarked on this initiative alone, we never would have had the biggest bigwigs in the sector attend and respond to our calls to action at our September launch event. As all now a strong and committed team, as well as friends. So we have a new network that we can mobilize when it makes sense to work together. And we can call on one another to support and amplify our own individual advocacy messages. So we've proved to the TB sector through this initiative that despite being woefully underfunded as community organizations and lacking in resources, we can have massive impact. Okay, so let's take a peek at this initiative. I'm going to share my screen. Dun, 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 dun. Okay. So this, I'll share the link in the chat box in a minute, but this is our landing page for all of the findings that came out of this initiative. And as I mentioned, there was a number of different key global CSO networks involved in creating and rolling out this survey. So the launch event that I spoke to, we had the likes of Peter Sand, Luchika, Mariko Pai speak on it, as well as a number of TB survivors and COVID survivors and key members of the community. So I do encourage you to go watch it. The recording's here. It was really, really powerful event and an example that you can maybe use and replicate in your own settings. Here is the table of contents from the survey initiative. You can go and access the full report if you like. It was really, really beautifully done and really well designed. So it has tons of great information in here, qualitative and quantitative data that you can draw from in your own work. But we knew that not everybody wants to read a full report. So we've also broken it down into more digestible sections for you. So there's a briefing of key findings and calls to actions. And then there's sections on each of the different stakeholders that we researched. I thought you might be interested in taking a quick peek at the TB researcher one. If you look here, this is all the quantitative data. We had 73 people respond around the world that were TB researchers. And something that I thought was quite interesting, 50.9% strongly agreed with the statement, my TB research involving laboratory procedures has been significantly interrupted or delayed during COVID-19. And as a last sneak peek, we also have a social media toolkit that you can all use. So if you click here, this toolkit, which when you are doing it on a budget, you use Google Drive, has been created for your use. There's pre-drafted tweets and some really, really beautiful graphics that you could use in slide decks or on Twitter, however you want to. So this, again, another key finding, we saw that 68% of policy and program officers from the US reported a significant drop in TB notifications, while 88% from Global Fund implementing countries did. So I'm gonna leave it there because I'd love you to go and explore this for yourself, but I really hope it gives you some inspiration and shows you an example of coordinated TB advocacy in action in the midst of a crisis. We did this with no resource. We just had the will to come together and make it happen and take a stand to make sure that the impacts of COVID-19 are being mitigated and that TB does not fall behind. Thank you.
Thank you, Robin. I was actually in a satellite session right before this, where the opening comments also focused on this report. And I think it's really awesome that in the peak of a pandemic, you guys were able to put together something so comprehensive. So I would suggest everybody watching, please do check out this report. Moving on to our next speaker, Dr. Saurabh Rani, who was also involved, and I think you also contributed to this report. But I think my question to you is really that, you know, you've been an XDR TB survivor yourself and now turned advocate since the past few years, and you haven't left any stone unturned in terms of your TB advocacy. So last year, I just want to share that last year when the rest of us, or many of us, were attending the Union Conference in India, you were busy scaling a peak with an elevation of over 7,000 meters as a part of your own TB awareness and advocacy efforts. So in COVID-19 times, like all of us, you have been confined to your home in Mumbai. So tell us, how have you adapted your TB advocacy in COVID-19 times?
Thanks, Karishma. And I'm glad you brought it up. Actually, last year I wasn't here at the conference because I had decided to sort of climb a high altitude mountain and make a point that, you know, there's life after TB. You don't have to just sit out of your home and give up on your dreams. And also bring TB to the global platform, right? It's not spoken about right now everywhere. And I think you really have to break that barrier for people to talk about it. So yeah, it's great to be here. Thank you so much for having me on this panel. I think Robin set the stage perfectly by talking about how badly the system is hit right now. So there are a few things that I've done to sort of find my way around doing advocacy during COVID times. And the first one starts with acceptance, accepting the fact that advocacy right now is going to take a hit and that patients need us way more than that. I think the kind of complaints or the kind of queries that have been coming to our virtual help desk that is run by a few of us in India has doubled or tripled in amount. And we have dedicated more than 50% to 60% of our time not going to panels and talking about what's wrong, but actually talking to patients and figuring out how to get them help. We've seen extreme cases where people have lost their lives because they couldn't find basic transportation to get to the hospital in time. And I think the first thing I've done is just adapt myself and make myself understand that advocacy right now also means just being there for patients, understanding their issues and floating these problems to the government, to the system, to their doctors, and help them realize that, you know, while COVID's here, TB is also here, and, you know, sort of patients still very much need you. So on a personal level, this is how we've made this change, is by dedicating more time to patients. The second one is now working very, very closely with the government, right? When you have your hands on the ground, it's sort of your responsibility to float up those problems, because while one person might have the voice to come to you and tell you that, okay, I'm facing this, there are 100 others who don't have that voice, right? So pick up their voices and amplify them to the system. Tell them, this is the problem that people are having in these areas. We quickly need to do something. You know, can you figure out a mechanism of sort of giving out the message, find the right person, getting them to the hospital, et cetera, et cetera. So we have a multilingual help desk, which is sort of operating right now. It works on WhatsApp call lines, in various languages in all regions, and we have a lot of patients. So our advocacy sort of focuses on helping the government understand how they can mitigate the impact of COVID-19 that's terribly affecting the TB system right now. And it ranges on an array of issues, right from I'm anxious, I have TB, what's the probability of me having COVID versus I don't know what's going to happen to me now, I'm not getting my medication, etc. So all the way it covers everything. I think the third thing that we've done is work with on-ground organizations. They are non-profit, for-profit, private clinics, all of them, anyone who provides TB services, to convince and advocate for continuing their services and not shutting down. So what happens during a lockdown is if you get one case of COVID in your private hospital, you're basically asked to shut the hospital down. I mean, it's not the case anymore, but that was the fear that private people were having, right? And it was sort of a good fear to have, but what about the patient? The patients have no place to go. TB services are getting cut off left, right, center. So, basically pushing for, how about doing, bi-directional screening, right? When you're testing someone for COVID, test them for TB as well. When you're testing someone for TB, test them for COVID as well. You have to realize you can't choose between one or the other. That's not a luxury we have, or that's not a choice we have, right? COVID-19 is hitting hard, and that doesn't mean that TB patients don't require their services anymore. They still need it. They still need to take their injections. I mean, they don't need to because we have all oral regimes, but I won't touch that sensitive topic right now. But they still need their consultations. They need to take their drugs. They need to go through procedures. They need your support. So currently, I'm just advocating for, learn how to coexist. And lastly, something that is very much nascent in the stage right now, but focusing on writing to funders and government agencies and HNIs to tell them, keep funding TB. You cannot just take away all the funding and push it into COVID, right? Everyone's at home, everyone's reading right now. We have to capitalize on that. So we are just writing a lot of blogs, a lot of media articles, multiple languages, not just in India, but outside as well. And leveraging the momentum that's been built by COVID-19 about respiratory diseases and TB to sort of make them realize that TB is a real threat. Even though it doesn't affect people from developed countries as much, it's very much existing in other countries, and it's been killing people for a long time, and it's still here. So, solving the problem requires a major step, right? That's talking about it. So we've got to come together and bring these issues to light. And I'm not saying ignore COVID-19. I'm just saying don't ignore TB. And just emphasizing again on this, right? We have to realize COVID-19 is here for a while. It's going to be here for a while, but TB has been here for centuries. It's killed over 1 billion people, and it's going to continue killing a lot of people unless we do something about it. We have reports which say that the outcomes this year are going to be even worse than what they have been, and our efforts have to step up and not step down. Our focus has to be on leveraging this wave of COVID-19 respiratory diseases towards the code of TB, repurpose their innovation, draw parallels, kill stigma, ensure we do everything in our power to solve this age, sort of solve this problem in this age that has been existing for years together. And I think this is our chance, and this is totally in our hands. And I hope we realize that we do something about it. So I think that's more or less the focus of my advocacy right now.
That's great. Thank you so much. And I think you've truly put a lot of your own time into sort of providing a voice for the voiceless, and sharing your experiences, and your advocacy efforts have been truly remarkable. And we'll hear more from you later in the Q&A. And next, I just wanted to move on to Lavazi. So before I ask Lavazi his question, I just wanted to sort of give a brief about this new global collaboration called the Access to COVID-19 Tools Accelerator, which was basically put in place in April 2020 to accelerate the development, production, and access to COVID-19 tests, treatments, and vaccines. So there are many global health actors, including the WHO, who are sort of behind this effort. And since Lavazi is also working as a part of the Access to COVID Tools Accelerator, I just wanted to provide this overview. So Lavazi, the next question is to you. You have experienced COVID-19 firsthand, and right now you're suffering from symptoms of long COVID-19. I'm not sure if everybody here knows what long COVID-19 is, so maybe in your answer you just touch upon that. So, what drives your COVID-19 advocacy efforts, and tell us a little bit more about the ACT Accelerator and your role. And yeah, over to you.
Thank you, and greetings to everyone, and thank you for the platform. I think I want to begin by saying there is the infection of the virus, which will be COVID-19. It will last a specific number of days. And ideally, you get over that. Most people do, but some people don't. And I'm one of those that don't. And that phase after you've been infected is then called long COVID. You've got symptoms that are persistent. I'm currently experiencing headache, and it is persistent, and as well as congestion, extreme fatigue, and brain haziness, or whatever it is called. There's terms for these things, and we are learning as we go. So my advocacy began with working with the Global Fund as a champion for the replenishment. And I work with GIFEN Africa, and we have, Robin mentioned a number of organizations they've worked with on the research, and Kanko is one of the organizations that is based in Kenya that is part of the GIFEN family. And through all of that, we have multiple civil society organizations in the region that work on the ground and we have access to. And that's the work that we do across 3 diseases, HIV, TB, and malaria. And so when COVID arrived, we were working towards the 2030 goals, which are Global Fund objectives. My experience has been that education helps people make better decisions. And so with COVID-19, a lot of misinformation was purported in the news media. Unfortunately, it came for the most part from the USA, from the president. And I'm not blaming anything at the moment. I'm just saying the minute we are not clear about what is going on, it then puts us in danger of people misbehaving, not intentionally, but because we don't believe there's a problem to begin with. And by the time we realize that there's a problem, it's often too late. And that's where in my country, in South Africa, we find ourselves. We are ahead of the tide, and suddenly we are one of the highest rates in Africa of COVID. And the advocacy is in educating communities, in working with civil society organizations on the ground. We work through SANAC, civil society organization, and we make sure that information is disseminated, that data is collected in terms of impact on TB, HIV, and STI treatment in South Africa, because that still needs to, and I think Saurabh mentioned, we still need to make sure we provide those services to communities that desperately need them. What I'm also realizing is that there needs to be education, and a lot of it around long COVID, because we will have, unfortunately, long COVID sufferers long after we have dealt with COVID. And we need research into that. We need understanding what needs to happen with regards to therapeutics and vaccines. And my excitement with being elected to participate in the accelerator was to be able to bring the voice of the people who have experienced long COVID, but also to speak on behalf of communities that are in fear. I started Pan Africa C19 Survivor Platform to provide psychosocial support. And I think Saurabh mentioned a lot of the fears are around not knowing what is going to happen to you. The first 14 days were scary because I did not know what was going on. But long after the 14 days, I'm not sure what is still going on, because one day I wake up, I'm okay. The next day, I'm not so okay. Even on the same day, I could wake up okay. By midday, I'm not okay. So there's quite a lot that still needs to be understood and researched. the impact that COVID has caused on TB is tremendous, and TB remains in South Africa the biggest killer. And so there's a lot of work that needs to still happen in terms of mobilizing resources to strengthen health systems, but also domestic mobilization of resources and funds to make sure countries are able to respond to their people's needs. And so that's where I am at the moment. And thank you for giving me the opportunity to speak to this platform.
Thanks again, Lavazi. And, it's really special that you could join us tonight, despite not feeling your best today. So I'd like to move on to Nambasa. You've, as I mentioned earlier, you've had your own experience with HIV and TB as well as COVID-19 more recently. And you're a frontline health worker. So from your perspective, what demands do you have, or what are your asks amid a pandemic like COVID-19? What do you think needs to be done differently, and what do you think needs to change on the ground as of today?
Hi, good evening, everyone. I think I'm very excited now to be in this platform because I already notice or hearing things that are very positive and good information, and for myself as well. Because when we meet, we also manage to get some information for other part of the countries. For me, I think my plea to this platform is to see that there is a progress that is in towards our community, and also the gap between the community and the clinics. If we can manage to make sure that we are doing that as a frontliners, and also the organizations that are working to help the community, are working to help the Department of Health, so that everything can go well. Because what we notice is that our community members are suffering there, not knowing what to do when things are like this are happening. Like when we experienced the COVID, it was like a chaotic in South Africa, especially in this province that I'm staying with, which is Western Cape. And also, I won't forget where I'm coming from, Eastern Cape, where I noticed that a lot of people died not having the information. As the guys already mentioned, that the key out of this is the key that we need to stand up for, or taking in this platform, is to make sure that we focusing on doing education in our communities, because our community, they don't know how to deal with the pandemic like this, and they don't have information. They don't have people that are making sure that they will get the information. Each and every time when they hear, they got scared, and there is no one who's like making sure that they are calm, even emotional, and they are not feeling good, they are not well. Even the nurses, the doctors in the clinics, you can see that they are not be able to help the community, because they are also shaking. So my experience on the TB side and HIV, it was like a struggle of like not having, or the clinics were like closed because of the pandemic, because all the clinics will notice that many clinics will have a person will tested positive, so immediately the clinic will be closed. So no one who's helping the community, and the community doesn't have the information that why the clinic is have to be closed, because there is no education. Because we are talking there, not like coming down to the patient, to the community, to explain what is happening. So a lot of patients that were having TB, they suffer a lot when the COVID was there, because there were no one who will help them. There will no one who will explain what is happening to them. They will just go to the clinic and find out that the clinic is closed. So it was like a struggle, really. But as counselors, or as a person or a frontliner who was like helping, because we never stop working, even on the time of COVID, we continue working. Then we managed to got them over the phone and talking to the community, trying to explain, doing the counseling. But it was not easy even for us, because we saw a lot of people that were like struggling, and also having COVID, it was like also a struggle to us as well as a frontliners, because we saw some of our colleagues were dying. So it was not like an easy thing to us. We were like very frustrated, because we saw that each and every day we had someone who was in hospital, someone who passed away, and it was our colleagues. So it was like a struggle, a lot to our side as well. But we managed to stand up and making sure that we close the gap. But for today in this platform, I will have to be a voice of the community, saying that the education is the key to all of this that we are going through: HIV, TB, malaria, and even COVID now, because you can notice that even though we say the COVID, the numbers are not like before, but you can see that we still have a less information, because people, they don't use the mask, people, they don't do what they're supposed to do, and we cannot blame them because we don't give them more information. They are vulnerable. They don't know what to do because they lost people, they lost their jobs. They don't know what to do. People, they lost their loved ones. They don't know what to do. So it's really a struggle. It's really a painful thing to see our community suffering like this. Like we have to do something. We have to do something. So on my side, I think it also affects me a lot, because even in my house, everybody was having COVID. It was not easy. My husband was having COVID. My kids was having COVID. But as a frontliner, I stood up and I said, I'm not going to give up. I'm not going to let my community die while I'm like, because of my experience for the family that I noticed that a lot of them, they have a COVID. I stood up and I went out and I continue giving the information to my community and work for my community. So yeah, it was not easy. I thank you.
Thank you for being such a fighter and for really going out there despite the fact that, you know, the whole family had COVID. I'm sure that wasn't easy at all. And you're still here with us today, so thank you for that. Do any of the speakers want to respond to another speaker's comments before we open it up for Q&A? Okay, so I think we have a couple of questions coming in. Robin has already answered the first one. And there's another question, which is, let me just read it out. It's from Trevor. It's about how are the indigenous or tribal communities doing with TB during COVID-19? Are they visible in the response? So I'm wondering, Robin, if you'd like to answer that from a Canadian perspective.
Sure. I can speak from a Canadian perspective and also a little bit on the survey initiative I shared. I think our other speakers can also speak to their experience and some of the information that's been coming out this week of all the new reports being launched. Yeah, so in Canada, well, we have, Canada's interesting because the way that our system works is Indigenous health is a federal mandated initiative, whereas for non-Indigenous Canadians, a lot of the response is owned by the provinces and territories. So in Canada, we do have specific funding going through Indigenous Health Services to respond to TB. And then we have funding that goes direct to like our metropolitan city areas where TB is more prevalent, running through province and territories. So that system inherently creates a bit of a, it's really important, but it creates a bit of a disconnect in Canada to bring in all the different voices. Work that I'm doing here in Canada to try and break down those silos and make sure the Indigenous voice is present is we've recently relaunched the Stop TB Canada network. And across all of the outreach that we do, we're trying to make sure that we have a global perspective present, a Canadian perspective present, which includes an Indigenous perspective. So recently, Trevor, I'm not sure if you were at the webinar we hosted, we had a nurse from Inuit on speaking specifically to the experience of her community in light of COVID-19. So that was one initiative that we've moved forward. In the global survey, it was disseminated throughout Canadian networks. There wasn't a ton of uptake or participation from Canadian healthcare practitioners, unfortunately. So there isn't enough data to say anything in this report specific to the Indigenous experience. But we also didn't collect demographic information like that. But I will say that the general finding of the report and our initiative was that communities, anybody that's living in a rural community is having serious trouble accessing essential health services right now. And TB programs are being devastated because of COVID-19. All resources are being rediverted to respond to COVID. So the community-led response right now is absolutely critical. COVID has shone a light on how important it is to support and invest in community-led responses so that there is a crisis, there's rapid mobilization to maintain essential services. And also it's context-specific services. So a big call to action coming out of our report is invest in community-led responses massively right now.
Great, thank you so much. Does anybody else want to comment on the same question? Otherwise, we can move on to the next one. So I think we will maybe move on to the next one. There's a question from Svetlana who says, are there some advocacy action regarding people in prisons? Usually they are more vulnerable than the general population. So I can tell you that the Stop TB partnership has done a lot of reports on this specific group of people, and you can check them out on their website. And I also know that in COVID-19, a lot of prisoners in several countries were basically asked to vacate during the peak of the pandemic. But I haven't followed that, so I don't know whether they've gone back in or what the status is. I'd ask all the speakers, does anybody want to volunteer to answer this question?
I mean, I can give a more generic answer to this. So what we've been doing is basically there are these separate identified high-risk populations, right? Old age homes, prisons, the orphanages, etc., where people are going to be sort of, so in India, in Mumbai, in Delhi, etc., they're highly densely populated, right? So one of the things that we are doing right now is, like I said, bidirectional screening. So that's one thing we're advocating for, just get everyone tested for both things and see if they have COVID or TB and then take actions accordingly. And the focus of advocacy for them has been as the top priority. Like anyone who's high risk should be given the first priority on this one. So it's not specific to prisons, but it's more on everyone who's coming under those high risk areas.
And maybe, Saurabh, I can ask you to answer the next question from Pamela, who says, what are you doing to advocate for community health volunteers that deal with the TB issues in the community?
I think that's a great question, primarily because, like Robin was mentioning, a lot of the workforce is now diverted to, COVID-19 management. And while we think that they don't have to do their routine work, the reality is it's not dividing your time into 50-50%. It's like do your 100% and do more 50%. So it's 150%. And one of the things that we are doing is just asking to increase their pay, right? Recently in the newspapers, you must have read that a lot of frontline workers actually went and started rebelling that we won't work if you don't pay us enough money. Because it is true, they are the backbone of developing countries, right? We can deny it as much as they want. They're the real heroes. They are the ones who put their lives at stake. They are the ones who go out in the field and do everything we can while we sit in AC rooms or attend conferences online. The truth is, we have to do what it takes to get them the pay that they deserve. And that's been sort of one of the key messages that we also give out is community work has to keep going on. So fund the advocates, fund survivors, fund peer support groups, fund people who are having feet on the ground actually doing the work. And one effective strategy is get someone in the room to talk about their experience. So if you have someone from the front line, just get them in the damn room where decision makers are sitting and just listen to how they spend. Just listen to how they spend one day in the field. And that's an effective way. I think that works.
Great. Thank you for that. And the next question is to Nambasa from Deepak, who says community awareness is very important to prevent and control COVID-19 and normalize TB services. But creation of community level awareness is not a quick process. It takes a long time. So what strategy do you think can quicken the process?
Thanks for the question. I think here in South Africa, especially in Western Cape, what we are doing now, we manage to advocate those that are the COVID survivors, and also involving the TB survivors, involving the HIV survivors, which is we group them, making sure that they are doing the education in the areas, in the bigger groups, which is on the maybe taxi ranks or going to churches. But we also know that the churches are not allowed to be a bigger numbers now. We also use the radio stations, which is the community radio stations, to do the awareness. We also making sure that the health promoters, which is the HPs, are going to the clinics to do the education. And also, as panelists are saying, that it's very important to make sure that we also, as frontliners, which is nurses, doctors, counselors, we speak out so that we can motivate the community as well. Because if we are still hiding or we don't share what we have experienced, it's going to be difficult for them as well to share, and to force by them to see us sharing the information that we had the COVID before, or we have HIV, or we are living with HIV, we also had TB before. It also encouraged them to be strong and to have to manage to speak out, and also to encourage each other in the community. So it's what we are still doing now, to making sure that the education is continuing, and we also making sure that we organizing the schools, having the talks in the schools, so that at least the kids or the youth knows about HIV, knows about TB, knows about COVID, that we are still dealing with it. It's not yet whole. Thanks.
Thank you. And I think before we run out of time, I just want to quickly ask a question to Lawazi, which is from Raquel, who says, what do you consider would be the best way to communicate the importance of community safety procedures against COVID-19? Do you think it should be different upon countries, or is there something that you have seen that could work all around?
I do not think it should be different. There might be nuances that each country is dealing with, but it should be the same information. We are all going through the same experiences, and humanity is dealing with COVID. And there's no difference, but there might be difference in each country based on what the atmosphere and the environment is. From the accelerator that I'm a part of, our primary, I think, call is for a rapid, I think, delivery of tests for COVID-19, as well as vaccines and therapeutics, so that we are able to avert more deaths And that's what WHO Find and the Global Fund has put together in the accelerator. And so we must have one voice and act now and act together against COVID-19.
Thank you. And I think someone's left a really nice message for all of you from Trevor. Thank you for being especially brave advocates who've lived with experience of TB, HIV, or COVID. You are all my heroes. And I really echo what Trevor is saying. And given that we have just 1 minute left, I just want to once again thank you all for taking out the time. We really need to keep the TB advocacy alive. We have to look for new ways to advocate, whether it's COVID-19 or the next pandemic or a tsunami. Something is going to hit us, and we just have to be prepared for that. And we have to keep going. So thanks a lot for joining us once again. I know it's late for some of you, and it's hard to share your personal experiences. It's not easy to talk about them, but we really appreciate that you were able to share that with our wonderful audience today. So thanks a lot, and hope you enjoy the rest of the union conference.